He's from I think it's called the Living Tree Clinic, and we'll talk to him in a second here. But this guy is an expert on addictions, especially pill addictions. Yesterday, we touched a big old nerve, and I've got a stack of emails here. Some woman saying that her daughter has been addicted to script meds for a long time, to the point where with her own stuff that she has to lock up. That's how bad the addiction is. Listener Heidi, she has a sister who's addicted to pain medications. It's mainly, I guess, morphine. She went through months worth in one weekend. So, I mean, we're just one after the next here. I've got somebody that I know it was at one point in time addicted. They kind of wrote to the show. Mrs. X, their ex-sister-in-law, is addicted to pain pills. She was married to the brother for about 3 years, and she always said that she had migraines, back pains, etc., and her purse was always full of pill bottles. So apparently she's got a pretty bad addiction to pills. Listener David, I mean, just on and on as far as people either knowing somebody or they have the addictions themselves. There's a couple sad ones in here. The woman lost her husband. My best friend died from ODing on pills. And if you missed the stat yesterday, in Utah last year alone, 307 overdoses on prescription meds. So that right there is
that just ODs, or is that ODs that resulted in death?
Deaths. There were 307 people that died.
That sucks.
Yeah, and it's more than illicit drugs. So I mean, these are figures that really don't get kind of highlighted when you think about it. Like, well, okay, I mean, you hear a story here and there, but people really don't talk about it as much as they should, Especially when you're hearing, pot bust, this, that. It's like, okay. Yeah. But these things are killing people, Especially when you have somebody in the house that has, you have a prescription. I mean, you're getting this from the doctor, and then you just get hooked on it, and you got to get more because you're not feeling anything. Just take it to the next level. So do we have him on the line, Dr. Lynn Webster?
Yeah, he's on the hotline.
And is it the Living Tree Clinic? Is that what it's called?
Yeah.
How you doing, Dr. Webster?
I'm well. Thank you very much.
Hey, thanks for calling us here this morning. We definitely touched a nerve with pill addiction. And a lot of people, I'm literally going through just a stack of emails after taking call after call yesterday. We had a lot of people, either Mr. X or Miss X, talking about their secret addiction. A lot of these people are addicted secretly, and a lot of people, the friends and the family all know about it, and they're kind of going through this. And some people want to get help, other people not so much. So you see this stuff every day, and I'm sure just from the response that we're getting, it's even worse for you.
Yeah, unfortunately, it is what I consider a crisis, not only in Utah, but throughout the country. Too many people, I think, don't appreciate the power behind the medications that are being used, both the harm and the benefit. So it's got us into a bind.
Well, do you think it should be a little bit more responsibility with doctors where they're not so quick to dish out these meds? You get what I'm saying? I mean, because I'm hearing from, and I know there's accountability on the patient side as well, but when you have a doctor giving you these meds and just writing one prescription after the next, don't you think there should be where there's a cutoff there, or the doctor knows that these are extremely addictive?
I think it's a complicated picture. First of all, I think it's important that everyone understand that there are millions of people and tens of thousands of Utahns who suffer from severe intractable pain, and unfortunately, there are many of them that will also commit suicide if their pain is not adequately controlled. On the flip side to that are the people who will take the medication as prescribed and still can be harmed by it. There's a balance that needs to be created between appropriate prescribing and appropriate consumption for those people who really need the medication. Yes, I think that physicians need to be aware of the potential harm that these medications can induce. I think it's also important that our patients understand the potential harm if they take the medications in a way that they were not intended.
Yeah, that's a good point.
Well, and I've never been given, granted, I never hooked up with, some of these crooked doctors we've seen on the news, but I've never been given pain medicine where the doctor and they at least haven't asked me if I knew how to take it. And then the pharmacist people always give me the whole spiel about, not taking too many, don't mix them with alcohol.
Yeah. I'm just saying, though, when you have, it's a catch-22. I know you have somebody there with pain, but you have to know that they're going to become addicted to these things, right? I mean,
well, no, that's not necessarily true.
Oh, it's not.
Most people, no, not at all. Most people who are prescribed an opioid, even for decades, do not become addicted. There's only a small percentage of the people who become addicted. It's important to understand what the definition of addiction means versus somebody who may misuse and abuse the medication. You know, people who are addicted are those individuals who want to use the drug for other than an intended purpose, and they'll continue to seek out the use of those or obtain those medications, and despite the harm that it's creating to their family and to their health. Those are the people who are truly addicted. Now, everyone who is placed on a strong pain reliever, and not just strong pain relievers, but also antidepressants, a lot of heart medication, the body begins to accommodate to those medications. And that if you then suddenly take those medications away, you can go through withdrawal symptoms that for many people are very, very uncomfortable, and so then they seek out additional medication just to prevent the withdrawal. So there's a difference between addiction and misuse and abuse. So very few people who are legitimately prescribed opioids for a legitimate purpose end up becoming addicted. They may well become dependent on the medication. And that is different than being addicted. Dependent is just like being dependent on your insulin if you're a diabetic. You need it to survive, you need it to function, you need it for life. But if you misuse it and you take more of it, just like taking too much insulin, you may die. Right. Or if you add a Valium-like drug when it's not appropriate to treat some anxiety or a mental health condition, and it's not, and your clinician is not aware of this, you're adding a potential risk from which you can die. And that's where we're running into a great deal of problem, not only in the prescribing of the medications, but also in the consumption of it by individuals who think that these medications can be like another aspirin or an ibuprofen. If one works, I'll take two, and maybe three will even be better. That is a fatal attitude.
We're talking to Dr. Webster from the Living Tree Clinic, and I got an email this morning, like I said, in addition to just a ton of emails from yesterday's show, but this is a scary one. Mr. X he says he's a functioning addict. He's got a couple jobs just to kind of keep his habit, where he works 80, 90 hours a week just so he can support this habit. He's gone through a marriage because he worked too much. But what's really frightening, and he knows it's frightening too, but he, I guess, just cannot stop. I mean, right now he is working, looks like on a medical detox unit as a substance abuse counselor, and he said, and he's enrolling in school to become a registered nurse. So he knows the irony with this, but it kind of goes along with all the doctors that are in the news, especially here locally with that Dr. Stack, who was just writing scripts to people. He didn't even see them. He
was dealing drugs. He was a drug dealer.
Exactly. So what are your comments on someone like this and someone that knows they need help but maybe doesn't know how to get help? I mean, really, there's a lot of people listening right now that don't even know what to do.
Well, but that dude working in the field, he knows what to do.
But what about the people that are listening that are scared to death because the husband doesn't know that she's hooked on pills? Nobody at work knows. The family, just nobody knows, and they've got this addiction going. So what would you say to them?
Well, I think that they need to talk to their family doctor first, and I think most of the family doctors will be able to help direct them towards the appropriate treatment. The first thing is to admit that you have a problem and then ask for it. And as I say, I think nearly all of the physicians will be able to direct a patient to the right type of treatment. Many individuals are afraid. Many individuals are afraid to seek out the treatment that they need.
Right.
Now, and it does require expertise in understanding why they first got on the medication, what other kind of health conditions that may be associated with the reason that they started the medications. Too often, mental health problems, an anxiety, a stress event, usually it's a stress event of some type, is the trigger that leads people to take more medication than they should take, or sometimes to even begin taking medication that's not been prescribed. So you have to treat the underlying problem that drives individuals toward getting some relief. That self-medicating of their anxiety or whatever condition it is what needs to be treated in order to treat the overall substance abuse problem.
What about I want to know what your thoughts are on this, and maybe this can be impacting or impactful with some of our listeners, because every other email, it looks like people that were addicted or are addicted, they're saying they're taking from 10 to 20 pills, talking about Lortab. So how long can somebody physically do that, or before they just die, or I mean, the brain damage sets in? I mean, how long
can go like their whole lives? My buddy was an addict for like 40 years.
Can you go that long without having major effects with this?
Well, it depends on the individual. If you take a drug that has Tylenol in it, like Lortab, if you take more than 3 grams of acetaminophen, the Tylenol component to it, and you may be causing yourself liver damage, and you don't have to take it for a long period of time to pose a serious health risk. There are people that are genetically vulnerable to even a lower dose, and then there are people that can tolerate a larger amount for a long period of time. But it's a roll of the dice.
Yeah.
And here that's not. I mean, if a physician's been prescribing a large amount, more than 3 grams of acetaminophen a day to a patient, then there needs to be something done about the education to physicians. But many times it's patients who are taking this, or not patients, just illicitly getting the drug. This is where these individuals need to understand the harm that can be caused to themselves and to their family and to the society because of what they're doing, taking too much medication that is potentially lethal.
Hey, and talk about some of the people that you see day to day, because I think there's still some people, the judgmental people, that are thinking, you know what, these are the cracked out people that are strung out on pills, this and that, because I really think that people need to hear that
it can happen to anybody.
Anybody. I mean, I'm not kidding. With some of these emails, they're just blowing my mind with, these listeners, and they're saying, look, I'm a professional, and I've got a husband and kids, and, in the church, and they're strung out on pills. So what kind of things and stories do you have with people coming through your office?
Well, the language here is important. Whether or not somebody is strung out sometimes can be a perception of the individual.
Good point.
I want to get back to what I said a moment ago. There are individuals, and unfortunately there are a large number of individuals who critically need these medications, just like the diabetic needs their insulin to survive. And yet there may be family members who feel that they don't need it, and they're afraid of it for one reason or another, and so they'll think that their family member is strung out on these medicines. There are people, however, who also have a serious pain problem, and for the rest of their life will need something very powerful to treat that pain, usually an opioid or a narcotic. But sometimes these individuals just get tired of the chronic pain. They get tired and fed up, so they want to take more medicine to get out of that pain, and they take it beyond the limits that the doctor has prescribed. When this occurs, that's a problem. And particularly if they combine that then with a sleep aid or a Valium-like drug, then the individuals will look like they're strung out, as you say, or they look like that they're over-sedated and drugged on the medications. It may well be that when this happens, most of the time it's because the patients have been taking more medication than they should. When this occurs, the family needs to be a part of the solution by bringing the patient, if possible, into the doctor and let them know that my husband, my wife, my child seems to be falling asleep at dinner because of this medication. That's a problem, and then the medications need to be adjusted, but so does the underlying problem that drives the individual or the motive to overuse their medication. It's not a simple problem. It's very complicated. It's not a matter of just taking too much medication. You have to understand what's driving people to do that if we're going to correct the problem and still have the medication available for all of those people who seriously still deserve it.
Somebody texted in 82945, and we're talking to Dr. Webster from the Living Tree Clinic, and they said, what if people don't want help? You've got a loved one, and you know they have a problem. I mean, because it's funny you mentioned about the passing out thing, and not funny, but I mean, it's kind of interesting. I have about 8 of those in the stack of emails where people, that was one of the signs, like my husband passed out in his bowl of soup, or, fell asleep. So what about, you got a loved one, they have a problem, and they don't want help. What do you do, from a doctor's standpoint? What should they do?
Well, it's hard if the individual doesn't want the help. But what you can do is talk to the physician. The physician can't necessarily communicate with you about what that physician is doing for your loved one, but you can certainly give the information to the physician. Oftentimes, and this has happened to me as well, we will have patients that will appear to be doing well, and then I'll have somebody within the family contact us and say, they always look good when they come into your clinic, but once they leave, then they start to take all of the medication in a short period of time, and they appear to be overdosing on a regular basis. Well, we don't know that unless we get some input. If we get that input, then I think that the responsible physicians will ask that patient to come in and have a discussion about the effects of the medication and the potential harm. And probably at that point, look for a different treatment. As much as possible, look for a different treatment. Remember, there is a reason why the individual is overtaking the medication. It may be that they just want to escape the pain, or they have another mental health problem or some other medical condition for which they need treatment, but it's not been adequately treated. We have to know what those are in order to help the individual, I think, optimize their treatment and maximize the quality of their life.
All right, somebody just texted and said, my mom passed away 3 years ago from her addiction to pills. She was only 45 years old.
Sad. But that's true. A lot of people, my father takes pain pills. He's taken them for years because he's had a lot of health problems, and he's not addicted. I mean, we haven't seen the signs. My mom's never said anything, but, there's some people that can control it. And,
And like he said, like the doctor said, I mean, there's a lot of people that have, this is a part of their daily life. I mean, they need these meds in order to I guess,
to function, or try and function.
It is. Let me say, it is really a tragedy when we see people that are taking more medication than they've been instructed, and they die as a result. That's why I'm speaking to you now. I believe that the unintentional deaths that have occurred in our state and are occurring throughout the country do not need to occur and can be reversed. It can be stopped cold. But the way this has to happen is that everyone in our community, everyone who's listening to you and me at this moment, needs to understand this is a serious problem, and we need to be engaged in helping our community make sure that the medications are used only as directed, never overused, and for the right purpose. And bring the attention to the clinicians whenever possible. I, on the other side, I'm doing what I can to help educate physicians. The Utah Department of Health is trying to do that. The Utah Medical Association. We're all trying to bring this to a higher level because I believe it is a crisis, and so do the other members of our medical community.
Well, especially looking at the numbers yesterday from our friend over at the state of Utah, said 307 people died last year due to ODing or effects from pain pills.
Yeah, it's a tragedy. It is a tragedy. I would like to point out, I started a campaign 2 years ago. Mm-hmm. It's called the Zero Unintentional Death Campaign, and people can look this up on our on the web. It's zerodeaths.org. One word, zerodeaths.org. Yeah. And again, the purpose of this is to educate the community, our patients, and our physicians about this, I think, this crisis, and how I think we can correct the problem. And I believe it can be corrected.
I just got an email in from a listener that says, Dr. Webster has been my doctor for over 7 years, and I'm doing much better than ever I could have done without his help. Wow. So that's, I don't want to say her name, but that's a patient of yours that wanted to just reach out and say thank you.
Well, there are tens of thousands of Utahns who do derive enormous benefit from the use of these powerful medications. But we cannot accept 300 deaths a year from the misuse, overuse, or perhaps even the wrong prescribing of the medications. All of that has to be corrected. It should be corrected, and it can be.
ZeroDeath.org. Can they get in touch with you through there, Dr. Webster?
They can. Yes, they can.
Okay. Well, we'd love to have you on again soon, because I'm sure we're going to be talking more about this. Tomorrow, we're actually going to have the investigator that I was talking about that gave us the stats. We've had him in before, but he's going to be in. He's the guy that was behind the bust of this Dr. Stack, who was basically just a drug dealer, just writing out prescriptions. So he's going to come in tomorrow, right around this time. We'll be talking to him. So, Dr. Webster, hold the line. Thanks for going on the air with us, and we'll talk to you real soon, okay? It's
Okay, thank you.
the Living Tree Clinic, by the way, and zerodeath.org if you want to check out his website.